Let me introduce you our guest today. Dr. J.P. Vice is the Associate Vice Provost for Health Sciences at Mississippi State University, where he's also an Associate Professor and formerly State Health Specialist for Cooperative Extension for a decade. He is the Associate Producer of the film production On the Farm. For farmers from the Deep South who have experienced the highs and lows of farming are the subjects of On the Farm. Viewers will hear firsthand accounts of the highs and lows of farm life from the farmers in each film. Experts in clinical psychology, family science, and economics are woven throughout each tale to link the farmers' real-life experiences to the body of knowledge on rural and agricultural lives. Thanks to this mini-series film, people will be able to better explain the difficulties of farm life to farmers and non-farmers who could not otherwise comprehend it. In the end, viewers will feel more assured knowing that although farmers face challenges, there is an opportunity for recovery from adversity. This Emmy-winning film was showcased at the American Public Health Association annual meeting in 2024 at the Public Health Film Festival. My name is Dr. Pietro Aparicio from 72 Dragons Health. Thank you for joining us and for sharing your experiences with us today. Dr. Vice, you are now Associate Vice Provost for Health Sciences at MSU, but I understand that is a relatively new development. Tell us about your work as Associate Professor and State Health Specialist with MSU Extension. Can you share about your role and trajectory?
Thanks so much for having me. It's an honor to be with you and the viewers. I'm honored to be a part of 72 Dragons Health via this production. So my background is, I guess fairly simple. I grew up in Mississippi in a typical undergraduate, graduate school. I say it's simple. It's a case of, folks ask me, how did I get into public health? I have to say it wasn't like this bright spotlight into the future of, I'm going to public health. It was really a case of more of, well, since this is a podcast about films, I'll reference Elsa, right? I've got a daughter who watches more Elsa than I care to admit. But so this notion of doing the next right thing, public health, my story in public health has been a case of just doing the next right thing. And I've landed in a good place every time I've taken the next step. Ended up at Mississippi State, which again, Mississippi is home for me. So the opportunity to work in public health in my home state has been a real honor. Cooperative Extension is the outreach and engagement arm of the land-grant university system. And so we have offices in every county of the state. Having grown up here, I'm very familiar with the land and the territory and the people. So again, being able to apply the public health skills that I learned in my educational trajectory as a continued part of my life and into my career has been an honor. My work is really about responding to the needs of the state. So I describe my role in public health as analogous to a family doctor. I'm not a clinician, but a family doctor and a community practice really just takes what walks in the door. So their first patient might be a 3-year-old that was up all night with an ear infection, and their next one might be an 80-year-old with dementia, and their next one might be a 45-year-old with hypertension. So in the same way, my public health practice has been about responding to the needs that emerged in front of me in Mississippi. And with farmer suicide, with farmer opioid misuse, working in a land-grant university system that's attentive to the needs of the agricultural community. The the ingredients were all there for me to begin this work, this focus that we'll talk about today, in health among the agricultural community.
Thank you for sharing. What motivated you to share these stories about the farmers and their life with the people through this film On the Farm?
Periodically, and I'll just harken back to what I said a moment ago, that in my role, my charge is to respond to the issues that emerge in front of me. And this was one that emerged as a real issue in 2016, that the opioid crisis was affecting farmers in a disproportionate way. So we knew we needed to do something because we had access to that population.
Yeah. Now, can you tell us what led you to select these specific farmers to feature in this production film?
Yeah, so that's also an interesting question. There aren't people just standing up on the street corner saying, film me, I want to tell my story of adversity," right? So getting folks to buy into doing something like this can be a real challenge. For us, it was a story of accessing our network of folks who are trusted in this community. So one of them came through relationships we have with the Mississippi Farm Bureau Federation. Others came through relationships we have with our county cooperative extension agents that know and work with these farmers. Some came from relationships that we have with faculty at the university. So, the key word there that I've said is relationships, right? All of this came about because of relationships and trust, and the fact that those featured in this film knew that they could trust, well, the people that they already had a relationship with, but also that they could trust Mississippi State University to shepherd their stories carefully and cautiously and compassionately. Because let's be real here. This is a tough set of content, and this is not about the glories and the joys and all the fun. This is really about the challenges, and we needed to convey to them, they needed to know that we were going to handle it carefully.
Yeah, talking about challenges, substance use and suicide are very important topics, along with the farm stress that has been talked about in the film. How are these different from other occupations?
One of the things in agriculture that we like to highlight, because folks don't necessarily just readily think about it, is the challenges they face are very, very, very much outside of their control. So they often, usually, own the land that they're working on. They may own the house that they live in, but farmers are what we sometimes describe as price takers. They don't get to say, like the folks at Walmart or your local drugstore, what the price is going to be on the shelf for the product that they've just placed. They are subject to what the market in the field is bringing at the time. Now, to be fair, our retail friends in retail can't totally set their prices. There is still a market that will govern what they can demand. But in farming, there is absolutely no wiggle room for setting those prices. Furthermore, farmers don't have any control over the weather. Farmers don't have any control over the cost of the equipment that they're buying to operate their farm, or the rules governing the laws and the policies from the equipment makers governing how they get their equipment serviced. So there are so many factors in agriculture that are outside of their control, and losing that sense of control, not having that sense of control, especially when things start to go poorly, can be very disorienting. And that can lead folks to that are subject to these situations and these circumstances to finding, a big 50-cent word here, maladaptive coping mechanisms, right? So approaches to dealing with that stress that are not ideal. It could be substance use, it could be other behavioral strategies that are not healthy. and ultimately it may lead to suicide. We know that it can be. Farmers have the fourth highest rate of suicide among men. Farmers have the fourth highest rate of suicide of any industry. It's troubling, but when you take a step back, you understand the stress and the challenges that they're under. It's incumbent on us in public health and healthcare and policy and those that look at bigger social issues to think, what can we do to provide more of a safety net, an emotional, mental, healthcare safety net for this population who is literally feeding us, feeding the world, providing the fiber for the very clothes that we're wearing. Um, we just need to step up and do more for this population.
Thank you for sharing the uniqueness of this community. Now, how does it feel to be recognized by the prestigious Emmy Awards for this film production on the farm? And are there any new film productions in the pipeline?
Thanks for those questions. Well, quite an honor, obviously, to be recognized with an Emmy Award. We were able to bring home a couple of Emmy Awards for the first series of On the Farm, and I have to give all the credit for that to my colleagues at the MSU at MSU Films with the Mississippi State University Television Center, which is a part of the Office of Public Affairs. Being a part of that group via this project has been one of the greatest privileges of my career so far. Frankly, I didn't think about film as a way to move the needle on this issue. So when I was approached by the television center director about ways that we might partner, this was all new for me, and I didn't I'm ashamed to say didn't think coming through graduate school and even health communications type classes that I took about film as a real way to move the needle. I can't tell you how much of an honor it's been to get not just the recognition, but the invitations like the one today to be a part of this podcast. I've done probably 50 or 60 screenings now with this film. The Emmy Awards is the long answer to say the Emmy Award, film in general, being a part of a group that makes excellent film is the real honor. To connect my expertise and resources with the expertise and resources of a group like MSU Films that's done such quality work, just remarkable, really remarkable. One of the pieces that's that's brought so many invitations to present this has been that we worked with someone to make a discussion guide. And the discussion guide has been something we could share out with academic partners who might think about using this. They've seen that we did the scholarly work to undergird this film, and from that they would say, oh, this is more than just a film. This really is an educational tool. And the discussion guide has been then the backbone of the conversation that we would have if we would go deliver this at a conference or as a continuing education activity or in a classroom. I was just with the School of Pharmacy a couple of weeks ago at our academic medical center here in Mississippi. And it's because we've got those educational resources to go along with the film to again, undergird. And new films, new productions in the pipeline, absolutely. And I say not just in the pipeline, they're actually out. We've got a second season of On the Farm. They tell stories in a similar way as those in the initial series, and they're available via the same pathways that you would find this film. Tell slightly different stories. We've got a veterinarian on there that talks about how the challenges are with working with large animal production and large animal care. We've got a catfish farmer on the film this time. We tell the second part of one of the stories from the first series with the Gilmer brothers. So just another set of strong, solid stories that help us move the needle on this important topic.
Yeah, well, congratulations on the Emmy Awards nomination to you and the team. Sounds quite impressive with all the nominations that they have. We wish you great success in your future endeavors. Farmers are the backbone of any successful society, and we're grateful to you for highlighting the farmers' challenges and providing them with resources to deal with their struggles. Thank you very much.
Thank you so much.